these community health workers can take knowledge where it is needed. They can take medicines where they are needed. They can take vaccines where they are needed. And they can also identify very serious children who need referral. So they can fill in most of the gaps which exist between medical care, public health care and people on the other side. So they would be an excellent bridge for health. That's why we need community health workers. Let me take an example of our one worker, Maya. Now, Maya has had schooling up to 10 years. Then she got married into that village, and that's the end of it. For rest of her life, she is going to cook, she is going to fetch water, she is going to work in the field, she is going to feed children, become old and die. But Maya, having been to school for a few years, she has seen the horizons. But that path is shut now for her. When she is selected to become a community health worker, that door again opens. She wants to grow like any human being, like you and me. She also wants to grow, but the life has shut that path for her. So that opening of the door is enormously appreciated by those community health workers. They are poor women, but they have enormous hunger for new knowledge, for growth. It also it's very gratifying for them because they are working for their own community. The mothers whom they support, children whom they save are right in front of them. Day in, day out, they see them subsequently. For doctors and nurses, when they work in hospital, the patients coming to them are strangers. Strangers come to my OPD, I treat them either in OPD or wards, and they go back as strangers. I have no social or emotional connection with them. So it's not very gratifying. For a community health worker, it is somebody from her own village, maybe her sister, maybe her friend, maybe her neighbor. So she is really helping her own people, and then that gratitude continues to echo back on her for years together. So they find it extremely gratifying. So the motivation and desire to work for the community is far better than salaried person. But let me tell you two things. One is a baby with asphyxia. Baby is born, maybe delivery was prolonged, and the baby fails to take its first breath. Now how much time do you have? You have maximum 3 to 5 minutes. If the baby doesn't take breath in those 5 minutes, baby is dead or its brain is permanently damaged. Within those 3 to 5 minutes, if baby has to take breath, the process has to be initiated in first 60 seconds. Who is there? No doctor. Will you now make a telephone call and ambulance will come and give ventilation to that baby? It's going to take hours. A community health worker living in the village, for example, Kajubai. Now Kajubai would immediately ventilates that baby with using ambu bag and gives its first breath, and that gives that baby the life. Few years ago, we made a list and we assembled all those children, newborn babies or children who would have been dead if there was no community health worker. And 2,000 children in those 39 villages are such who otherwise would have been dead, but today they are alive, they are kicking, they are playing, they are going to school, some of them are 12 years old. 2,000 children, they wouldn't have been there. And now today they are there. It's an amazing thing what community health workers can do. In Gadchiroli study, we found that the introduction of community health worker and pneumonia management and home-based newborn care approach has reduced infant mortality rate from 121 to 30. I am not aware of any other public health solution which can reduce IMR by nearly 75%.